Dear audience, let me show you my 6 months progress report in my research, Changes of the Mental Health through Pediatric Cancer Experience. My name is Márton Szabados. I'm a third-year pediatric resident at the Pediatric Center, Semmelweis University. And I work with Miklós Garami, Márk Hernátfői, Gergely Agócs, and Szilvia Kisdala. I really hope that in the near future, childhood cancer patients and survivors will live a rich and full life, and I'd like to take a part of it by establishing a well-designed follow-up system focusing on the quality of life of these patients. Here you can see the first two ongoing projects to help to reach my mission. The first one is a meta-analysis investigating the association between brain tumor localization and the prevalence of affective disorders in pediatric brain cancer survivors. Pediatric brain tumor survivors have a really high chance to develop affective disorders, and these disorders show themselves sometimes as flattened effects, but sometimes as severe diseases like major depression. The different areas of the brain are responsible for various capabilities, and function loss in one of these areas might lead to one of these affective diseases. There is a phrase, growing into deficit, which means that as the child gets older, all the diseases grow into them also and get more serious. Therefore, is a long-term follow-up from a really young age or from diagnosis highly recommended. So my aim is to identify which of these psychiatric diseases have the highest prevalence among the different brain tumor locations. And that leads us to my clinical question: does the location of the tumor predict the occurrence and the types of affective disorders in children with CNS tumors? And I hypothesize that there is an association between them. Here you can see my search key. My search was conducted in 5 different databases, and after a selection process, I have 42 eligible full texts, which are cross-sectional studies and cohort studies. So let me show you my first results. In this slide, you can see the prevalence of depression among childhood brain cancer survivors. We divided the population into 2 subgroups, infratentorial and supratentorial brain tumor survivors. The measure of effect is the prevalence of major depression. The events mean the diagnosed patients done by psychiatrists. You can see that the level of heterogeneity is quite high in this analysis, and it can be caused by the different follow-up times they used and also the subjective part of the diagnosis. As a result, you can see that there is not a real difference between the infratentorial and supratentorial group, so it's not mathematically nor clinically significant, the difference between them, but the overall prevalence is around 22%, which is a really high number, and compared to the healthy population, which this number is around 4%, it's 5 times higher. In this slide, you can see the prevalence of anxiety. We analyzed the same subgroups using the same methods. So as the results, you can see that the prevalence in the infratentorial group is 26% compared to the 18% in supratentorial group. Mathematically, the difference is not significant, but clinically, of course, it is. It gives us information and shows that we should put more focus on the infratentorial group in long terms. And like 1 in 4 children treated with infratentorial brain tumor suffer and deals with generalized anxiety disorder. In this slide, you can see the scores the patients achieved on different depression and anxiety questionnaires. All the questionnaires pooled are self-report questionnaires, and they function as a method to measure the impairment in the different aspects of these affective sites. The measure of effect is the standardized mean scores of these questionnaires. The points derive from 0 to 100. So you can see, again, a high level of heterogeneity, and next to the previous reasons, like follow-up times, it can be caused by that these questionnaires are self-reported. As a result, you can see on both depression and anxiety analysis that the infratentorial group reached higher scores in both depression and anxiety. And these findings are mathematically significant, and of course clinically it gives us direction that the infratentorial group should be assessed more further. So about the strengths and limitations, I'd like to highlight that during the analysis and reading the articles, all the methods pointed out the missing informations that will be needed for a more precise follow-up time for these survivals. And right now, these missing informations are limitations. For example, the lack of data about the follow-up times. As a conclusion, I can say that brain cancer survivals have really significantly more emotional impairments compared to the healthy population, and the infratentorial brain tumor survivals have a slightly higher chance to develop anxiety. We will use this information and put a closer psychological follow-up for these patients and focusing on infratentorial group. For further research, we will recommend cohort studies using standardized years as follow-up times, and also we will suggest using universal and harmonized questionnaires to be more comparable. Here I stay with the manuscript. I've written the methods and the conclusion, and I will submit my article on the 7th of May. As my second project, I will adapt and validate the Minneapolis-Manchester Quality of Life instrument in Hungary and the adolescent form of it. The focus in pediatric oncology has shifted more towards the long-term effects and the quality of survival. And there are actually really few questionnaires and methods focusing on the quality of life of these childhood cancer patients and survivals. So my aim is to provide a questionnaire focusing on the quality of life, and later to add it to the National Pediatric Cancer Registry of Hungary to use as a long-term follow-up method. And with that, to establish a better follow-up system for these patients. Here you can see the design of the questionnaire. It's a standardized patient self-report instrument for the children between the age of 13 and 18. It has 7 factors, and next to the psychical and cognitive functioning, it has domains about the body image and outlook on life, which are kind of new elements to assess the quality of life, as the previous one used in Hungary. So here I stay with the process. As the linguistic validation, I'm waiting for the backward translation right now. And as a part of the validation, I will conduct a cross-sectional study and then compare it with the findings with the already validated quality of life questionnaires. So as a summary, here you can see my 2 ongoing projects. I'd like to submit the first one this year in May and the second one in October. And I'd like to end my presentation with a part of a lyric by Leonard Cohen, which is "Ring the bells that still can ring, forget your perfect offering, there's a crack in everything, and that's how the light gets in." Thank you for your attention.
Congratulations. I was thinking that, do you have any personal experience about the higher prevalence of anxiety among children who are diagnosed with infratentorial brain tumors?
Yes, thank you for the question. Actually, during the analysis and research, I was thinking about it a lot, and also spoke with the psychologist in our clinic, in the neuro-oncology department. And yes, actually, you can see that they are not diagnosed with anxiety. But you can see some impairments. For example, they are kind of insecure and don't go out to play with the other children while they are in the hospital. It can be caused by a lot of things, for example, because of the movement impairments. And let me shortly just tell, all of this idea come from one of these aspects. A child approached me like 2 years ago that, dear doctor, I'm cancer-free, I got accepted to the university, but I actually don't know how to make any friends, and I don't know how to manage my life because I spent the last years in the hospital. So yeah, so these experiences helped to go through this.
My question is that what do you think, why do infratentorial tumor survivors have more chance to develop anxiety disorders? What could be the reason?
Yeah, as I said before, one of the reasons can be the impairment in the movements, and also like walking abilities and speaking abilities can be caused by that. And actually, this one of the most frequent type is medulloblastoma, with a really aggressive treatment, a lot of chemotherapy and radiotherapy, and these can lead to the more impairments for them. Yeah.
I have kind of similar question that I will still ask. Maybe I was wondering, like, if you thought about this division into infratentorial and supratentorial even before starting your project, and if you had any rationale behind it, if you can explain. Thank you.
Yeah, actually, at first, I was hoping that I can analyze like more and smaller parts of the brain, but of course the two main parts are the infratentorial and supratentorial. So that was like the big cup, and I tried to do more narrow analysis, but unfortunately there were not enough data. So yeah, it's also, I thought about that clinically, but then the findings are like that also.
Congratulations on your presentation. I would like to know if you are planning to analyze the different follow-up times, and in order to find out if there is a link between prevalence of disorders and the follow-up times.
Yeah, thank you very much. Yes, I do plan to. Actually, the follow-up times we used in pediatric oncology most of the times are 3 or 5 years after treatment. And in my data, we have actually a lot of cross-sectional studies are there. And the data about the follow-up times are more like ranges, so not direct this. They were measured 5 years after treatment or something like that. So for these ranges, we will conduct deviation for short and long-term follow-ups, and of course we will do the cutoff around these 3 or 5 years. So yeah, and we will see if how much of an impact they have on the prevalence.